In the average person, a healthy immune system is supposed to protect our body from illness and infection. However, sometimes the immune system can mistakenly target its own body cells, tissues, and organs. It's important that we talk about this today because autoimmune diseases affect approximately 8% of the global population, with women actually being affected more than men. Family history is important in diagnosing RA, but it's not the be-all, end-all of diagnostics. As women, we are very lucky. We have a 2 to 3 times more likely chance to develop not only RA, but autoimmune conditions versus our male counterparts.
Women are more likely to show those symptoms or carry that on.
The gut is our second brain. And so if there's anything going on in our body against the normal, the gut is a very good place to start.
Welcome back to Biome Breakthroughs. I am ecstatic today to talk to you with Emma, who works with us at Novel Biome. Emma recently joined us just this year and has been a fantastic add to the team. And she's going to be supporting us in some of our video outreach. So you will see more of her awesome and amazingness. And in this episode, we're going to look at autoimmune diseases, which is a very area that needs kind of more emphasis. People need to be looking at it more. And we're bringing Emma because she has her own experience with this. Emma, do you want to introduce yourself?
Of course. Thank you, Shaina. Hello, everyone. My name is Emma. So I work for Novel Biome here in operations, donor relations, and clinical outreach. So connecting the microbiome research to patient care. And as Shaina mentioned, I was actually diagnosed with an autoimmune condition nearly 6 years ago. So I am especially excited to dive into today's discussion and give my input as well.
And so as we always do here, we're going to look we're basing this off a really interesting case study that came out that I think sparked kind of Emma's desire to talk about this a little bit more. And I think the important things to understand is why are we talking about autoimmune disorders in terms of gut health? And I think as we start this discussion, keep the idea in mind that we know that the gut dictates about 70% of the immune system. So we know there's a ton of stuff that can negatively affect the gut, as well as age. But we have to remember that the gut is a big driving force in the immune system. So often when we see something or a flag that seems immune, it's also important to look into the gut and see if there's any connection there. So we're going to focus on rheumatoid arthritis to start, and we'll talk a little bit kind of generally about autoimmune diseases as well. But Emma, do you want to kind of explain what RA is and kind of in the context of, why do you think this is important to talk about? And then does it loop into the gut, especially from your experience?
Yeah, absolutely. So I think I want to start off by explaining what autoimmune diseases are. I know most people have a general idea, but I wanted to dive into that first. So the way that we can think about autoimmune diseases are, in the average person, a healthy immune system is supposed to protect our body from illness and infection. However, sometimes the immune system can mistakenly target its own body cells, tissues, and organs. And this is what we categorize autoimmune diseases are. So the immune system is attacking itself, which can lead to inflammation, impaired function, and in some cases, life-threatening complications. And it's important that we talk about this today because autoimmune diseases affect approximately 8% of the global population, with women actually being affected more than men. And I'm going to talk about that a little more in detail as well. So some autoimmune diseases are widely recognized by healthcare professionals, but there are some that are rare and difficult to diagnose. So this delay in the lack of the diagnosis can lead to prolonged pain and suffering and ultimately impact one's quality of life. And I know as myself, before I was diagnosed with rheumatoid arthritis, it was a very lonely time and I was beginning to lose hope. When there's something affecting your health and you don't have any clear answers, it's normal for us to feel alone and afraid at times. So I think this is why it's a very important conversation to have today. And there's lots of studies showing that autoimmune diseases are caused by genetic and environmental factors. And of course, with each person, it's hard to know exactly what those factors are. But as Shaina mentioned, the gut is actually a very good place to start because the gut impacts, like she mentioned, 70% of our bodily functions. And so talking about RA, exactly what it is and why it matters. So rheumatoid arthritis is a chronic inflammatory disorder caused by both genetic and environmental factors, like I mentioned. So this condition actually only impacts 1% of the global population. I think it's 0.24 to 1%. So a small percentage, but enough that it deserves some attention. And I am very passionate about it because I have seronegative RA, so it's not detected by a blood test. So it took about 12 to 13 months before I was properly diagnosed, which may not seem like a long time in retrospect, but those 12 to 13 months were very, very hard time. So this disease, I have it in my hands and wrists. It can cause pain, swelling, stiffness, and loss of function in joints. Now, RA is usually symmetrical, and it can start, like I mentioned, in the small peripheral joints, but then it can actually progress into proximal joints if it's left untreated. So not only this, but RA can actually impact other parts of the body, including the skin, eyes, lungs, heart, and even the blood vessels. And symptoms can range in severity and they can fluctuate over time. So periods of increased disease activity are known as flares, are often followed by little or no pain, and this is called remission. So as the condition progresses, it can actually cause the joints to become deformed and shift out of alignment, which makes everyday tasks difficult. And like I mentioned earlier, this impacts the quality of life. So the cause of RA is still unknown, as are most autoimmune conditions. It's likely triggered by a combination of both the environmental and genetic factors. Family history is actually a really important one for this disorder, although not always. For example, no one in my family has RA, so it's very interesting that I developed it. So I wanted to talk about each category. So I'm going to talk about how genes can affect RA, environmental factors, and even sex hormones, which will kind of segue into women's health. Yeah. And I don't know if you wanted to add anything before I segue into that, Shaina.
Yeah, I think an important part of this, both generally with women's health, but specifically with autoimmune disorders, often they can seem like invisible disorders or invisible diseases, especially early on, which leads to some of the difficulties in diagnosing them. And something we're finding or seeing in the literature, not specifically to all autoimmune disorders, but in some, we're looking at how to diagnose has been one of the biggest hurdles. And because it can cause long delays in treatment or any changes to help kind of reduce, especially in these cases, the inflammation, they're looking at alternate ways to diagnose. And so, recently there's been work in endometriosis, which kind of straddles the line to where it should fit, but often it gets kind of put into the autoimmune space or inflammatory space. But could we look at specific gut microbiome signals that are changed consistently along with people that have this? And so we're seeing people asking, like, what else is consistently changed? And can we use that as a way to diagnose early? And I think that's important and key for people to understand as to why we're talking about other areas outside of the immune system or what's traditionally looked at for autoimmune disorders, because not only for treatment, but as well as diagnosis, the earlier you can do this, the better, but as well, it can kind of pinpoint where are changes happening early on. Because, like yourself, Emma, and I've seen this, my sister-in-law has lupus. And when she first got diagnosed, she had been on and off really sick. And it wasn't until she had a severe flare to the point where she couldn't walk, was in a wheelchair because her body just turned off, just could not function. But she hadn't been diagnosed up to that point. So until she started in this kind of epic flare where there was a cascade of symptoms, she had just been sick, not knowing why. And it wasn't this and it wasn't that. And so, unfortunately, for a lot of these more silent diseases early on. You're not getting diagnosed or even looked at for it until you're past the point of where it could have been early helpful. You're into the symptoms, you're into the changes and the pain and those kinds of things. That's really not where we want to start diagnosing people. Something we talk about a lot on the podcast is, preventative health versus reactive health. So I think that's important to kind of keep in the context of understanding why this is an important discussion. Mm-hmm. But I'm interested to hear about kind of how genetics and the environment play a role, and as well as for always, how sex hormones are key, because, anywhere we can talk about the importance of looking at women's health is important.
Yeah, absolutely. So like I mentioned earlier, there are certain genes that can influence how the immune system functions. And so for RA, this may increase the risk of developing this condition. However, this is not always the case. Like I mentioned, family history is important in diagnosing RA, but it's not the be-all, end-all of diagnostics. So no one in my family has RA, but I just seem to be the lucky one who got the short straw, as they would say. So genes are important to look at, but they are not the only cause themselves. And so environmental factors, an example of this would be cigarette smoke or carcinogens. So these may trigger RA in individuals, but there's also other factors that researchers are looking at, including certain inhalants or even certain infections or bacteria. So certain viruses that your body may have, this can also contribute to the development of RA, because autoimmune conditions are when the immune system is attacking itself. So previous history with certain infections from bacteria or viruses can also play a role in the development of this disease later on in life. And so one of the other factors are sex hormones. So researchers think that sex hormones may play a role in the development of RA when genetic and environmental factors are also involved. So as I mentioned earlier, as women, we are very lucky. We have a 2 to 3 times more likely chance to develop not only RA, but autoimmune conditions versus our male counterparts. And it's interesting as well, they noted that RA in particular may actually improve during pregnancy. And then after we give birth, we may end up having a flare if we were diagnosed with RA. So the changes in the different hormones during and after pregnancy do play a role in not only the diagnosis of RA, but the flare-ups and the remission part as well. And so talking again about women, so I mentioned that we have a higher chance of developing RA than our male counterparts. We actually have up to a 4-fold increase. So we have a 4 times increase of developing these, and it is all because we have 2 X chromosomes. So lucky for us, we have 2 X chromosomes, which there was a study done at Stanford Medical School, and they were explaining that because women have 2 X chromosomes, we actually have twice the amount of these murate proteins. So because we have 2 X chromosomes, how the body works around this is something called X chromosome inactivation. So I won't bore you with all the details, but the general gist of it is that in early embryogenesis, the female mammalian body makes this independent decision to shut down one of our X chromosomes, which is called X chromosome inactivation. And so this will decrease the amount of murate proteins surfacing around in our body, because otherwise this increase of murate proteins can actually be lethal to a cell. So this X chromosome inactivation is how the female mammalian body has worked around having these 2 X chromosomes. And there was another study done by Delisa Fairweather and her colleague, and they explained that there is evidence indicating that sex hormones may exacerbate autoimmune diseases in women by increasing the adjunctant effect of infections. So as I mentioned earlier, infections can actually increase your chances of having RA, but in general, increase your chances of having an autoimmune disease. So there's lots of research surfacing, a lot of new research surfacing, especially in women's health and in regards to autoimmune conditions. But I just want to stress that being a woman herself, and I know Shaina can agree with this, there is a dire need for future research in women's health, especially those with autoimmune conditions, because as Shaina mentioned, they are a silent disease. So it's not something that you may see on the outside, but they are actively happening on the inside. And if we don't talk about them and, we don't join a community where we're able to discuss these things, they kind of go left untreated and they stay silent. They stay a silent disease. And I think it's really important for us to have these sorts of conversations, to bring awareness to it, but also it creates a sense of community and know that there is research being done and we're going to lead with treatment and support for anyone who has any of these conditions.
Yeah. And an important thing to realize in terms of the importance of discussing women's health, recent research in the last couple of months has come out. Not only is women's health underfunded significantly, somewhat tragically, but the other thing that comes with this, the fact that we're not asking the questions and we're not forcing it, there's two predominant, the X and the XY, and we've kind of only looked at one of the two. But the key here is that women tend to suffer longer and in longer pain before being diagnosed. And this is consistent across diseases. And so it's important for us to understand it's not only asking the questions and figuring out how we treat it. It's the fact that people are being left untreated. And this is significantly weighted for women. I think the other important part is that the number of diseases that women have more of, and often these are age-related diseases, autoimmune diseases, as well as sex-related diseases, things like endometriosis and POTS. There are a lot of us suffering and not talking about it. Even genetic-based disorders, women are more likely to show those symptoms or carry that on. And so I think there's lots to say negatively about social media, but I think the idea that more people are having spaces to talk about and finding other people and understanding, while you may have a silent chronic condition, hearing other people talk about it and realizing you aren't alone. There are a lot of people suffering with this, allows the voices to get louder and kind of force the need and show the weight at which we need to start asking and looking at these questions and concerns. And it is something we want to actively look more into and support people who are trying to figure out, how do we tackle these diseases? What are the right questions to ask? What part of this puzzle is missing? Because why are women showing it more than men? What's happening there? And we tend to look a lot at the hormone side of things because those are different. We know they're different. They cycle completely differently. But there are things that doesn't answer the question for. The other side is the mystery that is pregnancy. I don't know how long people have been having babies. It seems like a long time. There's a lot of us kicking around for a long time, but we still don't understand pregnancy. And we understand and we focus so much more on the developing fetus and how that's happening and how are we making and how is there, life being born. But so much happens to your body while you have a child. And I have a close friend of mine who has RA. Even being able to get pregnant, she had to come off all of her meds for an extended period of time so that wouldn't impact anything during development. And post having a child, she couldn't go back on them right away. And so therefore, she has a newborn child and is in significant pain. Like, as you mentioned, Emma, having a flare soon after giving birth is quite common, but you still have to care for a small child. And so we don't have a system set up that isn't so hard on the body to treat. You're trying to treat something, but it is quite intensive, that there are people being impacted by this. But as well, my friend's a nurse. And so she said, there are times I have a flare, but I've got to work a 12-hour shift. And so how does that work? And so the fact that she does in the amount of pain that she is in says a lot. And I think that's, something to note about women facing health issues. The number of women I know that have chronic conditions, myself included, that you're like, I can barely move today. Well, I guess I'll stretch, hope a warm shower helps, and off you go. And part of this is societal conditioning. The fact that, a lot of, severe cramping during menstruation is similar to a man having a heart attack. And the number of women I know that go about that with a Tylenol and hope for the best, or an Advil, and just make it work for the rest of the day. That's part of how we've been we just kind of make it work. And there's many reasons and many layers to how we've gotten to this point. But I think it's important. And I love seeing the growth in the conversation of like, why is this happening? And why are we okay with it? Like, why have we been okay with like 4 times as many women have these conditions and we don't really know how to diagnose it? And the treatment's not really great. And now people are going, you know what, actually, I don't think I'm okay with that. And we're seeing a pushback on it. And there's some amazing female researchers that are out there having these discussions, sitting on news couches being like, the main problem is no one is funding it. No one's asking the right questions. And why aren't we? And I think that I love seeing that change. And the more you talk to women about their health and the fact that I think the tone has changed so much. And, you know, the more there's a pushback, the more the questions are being asked. We're going to see a shift in how we treat. And I think you're seeing that across the board in terms of like, are there better ways to diagnose? What other options are there for treating and getting an understanding of outside of hormones? Is there anything else that's different about women, that our systems just work differently? And it doesn't have to be because of estrogen or progesterone or any of our wonderful sex hormones that like to, you know, regulate themselves and do their own thing. But also we remember sex hormones change over time. So like, you know, what's the change in perimenopause? What's happening in menopause? How are women changing during that phase? And is that leading to some of these other chronic conditions we see in aging? So I think such an important conversation to have. I can guarantee you it will not be the last time me and Emma will be sitting here and talking about it, because I feel like something that every voice matters, and the more people that understand what happens is key. But in autoimmune conditions, you know, because it's silent, I think it's really easy to overlook it, especially for someone that during their flares has found a way around it. And so people forget that just because you don't see that someone is ill doesn't mean they're not suffering. And so, you know, we need to kind of find better treatments and ones that aren't so hard on the body. I know in a lot of cases, specifically with autoimmune conditions, the way that we treat them is also very hard on the body. So it's not really a long-term fix, because you can't do that for a long time as well. And for someone as young as yourself, Emma, to be dealing with this for 6 years already, to been, you know, you have a lot of life in front of you. So what does that look like long term? You can't go anywhere. I need you. And so I think that's an important thing to bring to light, that just because, you know, you show up every day and you do an amazing job, it doesn't mean you feel 100%. And so I think it's such I want to say cool conversation, because the idea that your immune system can just like we know it's how important it is. The fact that there are a group of people that it just doesn't work right. It got the wrong set of instructions and has completely went haywire is fascinating, because it's a system that's supposed to kind of come built in. It's on your base model. But when that doesn't work, there's so many other things that happen because of it. And I think something that makes sense, and I talk about this a lot, like when you look at it logically, now that we have more information, it makes sense that the gut may be tied to autoimmune condition because it plays a role in the immune system. But before, like 5-10 years ago, no one put that together, because the immune people didn't talk to the gut people, and the gut people didn't talk to, you know, the brain people, and everything was kind of separated. And the more we learn and the more we start understanding why this could happen. And we know there are gut conditions where the gut kind of attacks itself. And so, you know, every system within the body, the brain has systems where the brain starts to attack itself. All of these things, like your body can turn on itself. Why? Not productive, not really a good plan, body, but it does it. And so I think the more we start asking systematically, your body is one whole unit that works together. So instead of just looking at each piece independently, the more we get into this functional or integrative space where it's like, okay, so like everything works together. So this is what we're seeing as the end or the output. Let's step back and see what other systems have went off the rails that could have led to this. And so I'll let you kind of describe this a little bit, Emma, but the case study was kind of looking at the connection between rheumatoid arthritis and the gut and how FMT may play a role.
Yeah, absolutely. And I was going to mention too, when you were talking about the immune system, you know, there is no set of instructions that we're given. Typically the healthy individual, the immune system is working to prevent certain diseases and protect our body. It's like when you go to IKEA and you have a new table and you have the instructions, this is typically how it would go. But those with autoimmune conditions, it's like having those instructions in, Chinese or Japanese, and it's not a language that your body speaks. And so it's not working in the normal way. And so there's lots of different treatments that one can do for RA or any type of autoimmune condition, a lot of which are actually immunosuppressants. And so therefore, we'll suppress the immune system so that it's not attacking our cells, which can decrease the flare-ups and put one into remission. But the problem with these medications and, biological treatments is, as with anything, there's a long list of side effects. So this is sparking interest in looking at alternative treatments, one of which is important to mention, as we have many times, is the gut connection. So the gut connection with autoimmune conditions. So the gut microbiome, as Shaina mentioned, the gut is our second brain. And so if there's anything going on in our body against the normal, the gut is a very good place to start. And we're going to talk about a certain study that discusses RA and its connection to the gut microbiome and FMT, which is what we do here at Novel Biome. So there are actually several studies that suggest that the gut microbiome plays a key role in immune regulation, which makes it a promising target for intervention in autoimmune conditions such as RA. So the altered intestinal microbiota in RA patients is what suggests this as a therapeutic target, and that if we focus on this and restoring the gut homeostasis, this may be crucial for patients with RA. And there's numerous studies that have reported that the altered gut microbiome in RA patients compared with healthy individuals, we have results on the diversities and the species richness, and these are actually inconsistent in those that have RA. So there's many different types of bacteria in our gut, and those with RA and any sort of autoimmune conditions, there's some dysbiosis in the gut. So there may be an increased level in the bad gut bacteria and a lower amount in the good bacteria that we need in order to thrive and function normally. And along with the medications, so there's 3 different types of medications for RA specifically. There's disease-modifying anti-rheumatic drugs, there's corticosteroids and non-steroidal anti-inflammatory agents. All of these medications, they're finding, actually can alter the gut microbiome. So these medications alone as well, on top of the dysbiosis in the gut for those who have autoimmune, we're already stirring up problems in the gut that is in dysbiosis already, So although the treatments may help, we're not actually getting to the root of the problem because these treatments are further creating more problems in the gut specifically. And so the study that we want to talk about today is actually a live study. So it's done, I was 20 years old when I was diagnosed with RA, and this patient in the study is also a 20-year-old woman with a 5-year history of RA. And so she was taking similar medications that I were, methotrexate, which I know is used for a lot of other conditions as well. But of course, as I mentioned, certain treatments can have severe side effects, one of which this particular patient experienced with it, which is nausea. And so basically this study is looking at the treatment type that the patient was administered, as well as her flares throughout the 5 years that she was diagnosed with RA. And then what they did actually is they did FMT treatment for her, and then they tested the rheumatic factors and the frequency and intensity of her flares after administering the FMT. So for those who don't know, FMT, if you're new here on our podcast, a fecal matter transplantation. So basically what we're doing is we're taking the healthy gut microbiome from a donor, so a healthy individual, and we're implanting that into a patient who has gut dysbiosis. So, for example, there's different formats for this. So we have capsules, we have an oral powder, and then an enema and colonoscopy option. So basically, we're taking the good bacteria from a healthy person, and we're implanting that into an unhealthy individual who would greatly benefit from having the healthy bacteria restored in the gut.
Yeah, and the idea is you're providing the right instructions. Yes. The idea behind FMT is it re-educates the gut to do the job it was supposed to be doing. And so a lot of people are familiar with probiotics in this space. Probiotics don't engraft. So they're like travelers. While they're there, they're doing the job, they're waving, they're seeing the sights. And as soon as you stop taking them, they leave. The plus here is with FMT, it's an encapsulation of the entire gut microbiome. And then when that's implanted, it helps re-educate and engraft and becomes a new microbiome for that person. And we know that it's donor-like, but it's actually distinct to the recipient. So there's part of this that plays at, your environment, your genetics, all of that plays a role in which bacteria will be most useful. So it's an interesting concept. And the idea here is, if we talk about the gut being the second brain a lot and how it is a driving force in a lot of factors within the body. But it's funny, the gut comes first before the brain develops. And so an underdeveloped gut cannot send the right signals to the brain for it to develop correctly. And they're all the same tissue types, which is a whole complicated folding of tissue development during the embryogenesis. But the idea here is that the gut is signaling everything. And so when that has the wrong composition, it doesn't have the right diversity, or it has, a pathogenic overgrowth, or literally just doesn't have enough diversity to kind of do the job and give the right instructions, things can go poorly. And I think it plays a role in what what you're predetermined to have, but as well, we talk about the gut playing a role in so many things. And sometimes, me included, when I first kind of really dove into this space during my earlier academic years, when I was looking at feeding hormones and memory, really, does the gut really play a role there? Can it really do that too? Can it really do that too? And the more you peel back the fact that it takes everything in and pulls it apart and decide what things we should keep to make the next, vitamin or neurotransmitter, or, get too many inflammatory bacteria. So then it's starting to signal out like everything should be on fire. Let's light it up. You kind of want to ensure that the right instructions are there. And, we talk about an autoimmune disorder is like your immune system, having directions it can't follow. So it starts doing the wrong things. When the gut is doing the same thing, you can start seeing this kind of leads into other systems. It's telling it the wrong signals. And so it's a beautiful thing, the idea of okay, so the immune system and the gut work together. If the immune system isn't working, if we give new instructions to the gut as to how it should work, could that then lead to the immune system getting the right instructions or better signaling? And so in this study, they kind of categorize where does this patient sit right now? What has her disease progression look like? And use that kind of as this pre-treatment phase. So what did she look like before we decided to kind of educate the gut? And then they're doing FMT to kind of give the gut the right instructions, and then looking at, so now that you have the right instructions, how does your disease look? And from my understanding, please correct me if I'm wrong, Emma, but they saw significant improvements across the board in her symptomology for her RA. Is that right?
Yeah, that's right. Yeah.
And so from your perspective, as someone who has went the route of kind of understanding the traditional treatments and what the side effects look like, and I think also important to understand in autoimmune disorders, you have an autoimmune disorder, and often that can trigger other disease states or other symptoms that aren't specific to your autoimmune disorder, but you are more higher at risk, because you're turning down your immune system so that leaves you kind of unprotected for other things. But as well, it's not that having it makes you more likely to get it, but it's literally your body is doing so much work to stay as stable as it can leave you open. And this is, I know, common in the autoimmune space to deal with other conditions or other symptoms that are theoretically unrelated, but you see a higher percentage of. And we see this in a lot of diseases where, things like chronic fatigue. I think it's like 70% of people have chronic fatigue also have IBS. Yeah. And so which comes first, chicken or the egg? Hard to say. Is it the IBS that causes the chronic fatigue? Does the chronic fatigue leave you open to having these other gastrointestinal symptoms? Does chronic fatigue have a gut tie that is related to IBS? Are people with chronic fatigue and IBS actually a different subtype? It's a whole different disorder. Again, we could talk all day about how we categorize and put people in buckets. Again, chronic fatigue is more prevalent in women as well. Shockingly, the thing we don't think about. But I think that's the idea. It's not just this one disorder, but having one disorder that goes untreated or the treatment is so harsh that it causes secondary issues, you're more likely to then deal with other chronic conditions or other symptoms that impact your wellness and lifestyle. So I think this is, and it's a case study, and I try to highlight this. Most of what we know about gut health and the importance or the changes that happen with FMT is completely just like one person did this because they were dealing with something else. And then we see improvements in this condition that we didn't think was even related. We see this, a really good example of this was in Alzheimer's disease. They had mild to moderate Alzheimer's and got treated for C. diff, and their cognition improved. There was no goal there. That was not a plan. There was no idea. There wasn't like, it makes sense that like Alzheimer's and FMT would go together. It was literally like they had a severe case of C. diff, was hospitalized, did FMT to deal with it. And while they were currently undergoing treatment for their Alzheimer's disease, they showed significant improvement in their Alzheimer's symptoms. And the only thing that had changed was the FMT. And so now we have an entire group of people asking these questions. Where does cognition play a role? What neurotransmitters are there? But I think the same thing is going to happen with autoimmune disease, because you're having these cases where people are like, this makes sense. We have a patient that is non-responsive. They're open to an alternative treatment. Let's look and see what happens. And then you see these, sometimes miraculous, like this person's been treated, they're a non-responder, or they are a responder, but the impacts of the treatment is too high. Like they're not going to stay on the treatment. And part of a treatment plan is this person going to keep doing this treatment, or is the side effects so bad that it's going to be like, which one's worse? And then you see these improvements in their lifestyle is going to improve, how they feel, their ability to be part of the, do their jobs and integrate with their society and have friends and go out and be active, which are all extremely important for your general wellness. To think that, let's try this and see. And that's the beauty of these case studies, or these kind of N of one studies where we don't know. It makes sense. Logically, this could work. And you do it and you go, wow, that was a larger impact than we had expected. Okay, so let's continue asking that question. And that's something I love about having these discussions, because I think if you had asked me 5 years ago or more, I don't know, I don't want to age myself, 10 years ago, I think at this point, I was a brain person. I only looked at the brain. I was a neuroscientist. I was very hyper-focused. Why are these things important? And then I was lucky enough to ask the question and just end up being connected to a lab that looked at feeding hormones in the brain. I wanted to look at it, feeding hormones in the brain during aging and in the conditions of Alzheimer's or dementia, because feeding hormones change as you age, as does everything. We're falling apart.
Everything.
But the idea was there's a huge amount of these receptors in the area of the brain that does memory. So what happens when they are gone? What does that mean? What does that look like? And then that leads to the question, okay, so why are there feeding hormones in the brain? And why are those changing at a similar rate to the gut's deteriorating? And we're seeing deterioration in that brain region. And so you can keep asking these questions, and you get to the point where you're like, okay, so something there is connected. And to age myself, when I had started in the neuro field, we didn't know about the gut-brain axis. That wasn't a thing. It was a very exciting time to be in the field when we started going, these have to be connected. And as a memory person, understanding how the brain interacts with the gut, even in early development. And then you see that later on, and we talk about the biggest and most significant changes in the gut are at birth or early years up till about 3. And then as we age in the later years, the gut does the most work. And one of them is building it and the other one is dismantling it. Unfortunately, we got a couple good years there in the middle, but it's these key things. But that's the key in the gut, and it's the key in the brain, and it's the key point in the immune system. When you look at the immune system, it starts to come online early, and it's getting its first set of instructions. And as you go later in life and we get into what we consider an age profile, one of the biggest things we talk about now in aging is that the immune system is no longer functioning. Inflammaging. I think that's how you say it. It's like inflammation and aging whooshed together. We're not always scientists. We're not the most creative name makers, but the immune system stops working. So now we've got the brain has the same critical periods, and the gut has the same critical periods, and inflammation, and the immune system has the same critical periods. And do we think they're probably all talking to each other during these critical periods? And is this instructions that we're getting early on? It may not present itself in those critical periods, because that's the beginning, that's the building. But if it gets built improperly, all of a sudden, you're in your 20s or your 30s, and a lot of stuff is going on, and you have stresses and life changes, and it doesn't have the right instructions, or it wasn't built properly at the beginning, and then we see these issues. And so we talk a lot about preventative medicine, and the idea here is preventative medicine has to happen way before. So we really need to understand, what does a condition look like? When is that instructions created? How do we look at it to ask before someone is coming and saying, like, I just can't function like this. I don't know what it is, because no one is that in tune with their body, or very few people could be like, I know when it happened. I've gotten to a point now where whatever is happening, I can't function. And now that I haven't been functioning, I'm not sleeping well, and I don't want to eat, or when I do eat, I feel terrible. But 2 years ago, it wasn't eating. It's just that so many things have become dysregulated because of this initial thing, that now all of my symptoms are triple what they were 2 years ago. I knew 2 years ago there was an issue, and I wasn't sure what it was. And then 3 years ago, it looked like this. And now I'm, 4 or 5 years in, and my symptoms are huge because so many things aren't functioning. And we talk about this. When you fix a problem, it takes a long time, and the body's going to have to rewire, because often the symptom is that we think of as, oh, this is the disease. It's actually 5 years into that person presenting with the disease. So they have now 5 years of chronic changes, lifestyle changes to try to augment so they don't cause flares. And different systems have started working differently because they're not talking to each other properly. And so I think in women's health, we need more, and in preventative health, we need more. And often those are probably going to go together, but it's how we ask the questions. And so that the whole point of this is, like, before listening to this, how sure were you that the gut and the immune system work together, and that the gut could be a factor? Not saying that the gut causes autoimmune conditions. There's so much to that. Like I said, all these critical periods, and they're all happening together, but they're linked somehow. And restoring one can help restore the other. And so the important part here is, like, okay, so now let's ask questions differently with this new data point. So before, we didn't think about the gut. Okay, so how does all the information we have look differently now that we have this other part of the puzzle? And the idea here is, conditions, especially chronic illness, is not one puzzle piece. And often, we talk about how long someone's had a chronic illness is different than someone who's just starting with it. And, I will talk about for the rest of my life about understanding Parkinson's disease, because it was my moment of going, okay, so I need to figure out where are the people who ask that question, and how do I join that bucket? Because the idea is, like, Parkinson's, by the time you are diagnosed with Parkinson's disease, it's maintenance. It's very rare people cured with Parkinson's disease late into the disease. But the researchers were like, okay, so, like, what did people look like 5 years, 10 years, 15 years, 20 years before they had Parkinson's? Is there anything consistent in their health profile to say, okay, so, like, 10 to 20 years before they had Parkinson's, 80% of them all presented with the same GI disorder or GI condition. Okay, so, like, that's a lot of people with Parkinson's having the same issue way before they had Parkinson's. And unfortunately, this study happened a long time ago, and we're still trying to understand it. But the idea is, okay, so, like, is Parkinson's part of a cascade of things that have started way before? And I think that's so important to understand when we're thinking about preventative medicine. a lot of it has to do with, okay, so here are 1,000 people with this condition. Let's look back through their health history and see, is there anything else that all of these, or a very good number of these people had before they were told that they had something like RA? So when they were a kid, did they have something consistently? When they were in their teens, did something happen consistently? So that we can go, okay, so now that when that thing happens again, maybe we need to do something to prevent it leading to this, right? So I think it's fascinating. It changes the game of how we're asking questions, is less about symptoms and treating them and more about what was happening before, so we can prevent the next person from dealing with it. As well as, I think sometimes we have to understand more women are looking at this. Okay, so like, let's ask the question differently in women than we are in men. Let's not undervalue that men also have this condition. And I think that's a big fear sometimes with the idea of focusing on women's health. It's just, I don't think the same question applies to both, because especially if the treatment is more effective in men than women. Okay, so like, we can't keep asking the same thing. Let's look at it. And especially in autoimmune conditions and RA, if we're finding that a lot of people are getting it in their 20s, were they actually showing it in their early signs in their teens? What happens to women in their teens that could be triggering an autoimmune disease, right? So let's ask that question differently, because there's a different bucket of women, and they respond differently, or they present differently. I think, we think of schizophrenia as a more male dominant disorder. Women present with schizophrenia in their late 30s. So is it the same? Are the same questions from someone that's going through early brain development triggering schizophrenia different than women? And what's happening in those two time points in terms of hormones or brain development or those kinds of things? So sometimes it's how the disease presents or when is different. And sometimes it's just women have it more than men. So I think, all of these things are important. Sorry, my phone's ringing. But I think it's a fascinating beginning of a discussion, and especially something like autoimmune conditions and working with you, Emma, and knowing other people that have RA. It's hard. And from the outside, it doesn't look maybe like it would be that hard. And so I think this is such a cool look at, okay, so like, what else could we do? And I think it's fascinating that and we talk about autoimmune disorders in this space, but I think like understanding that the gut is sending out something or preventing or presenting some type of instructions, and resetting that could have a role. So I appreciate you kind of bringing this up as something to talk about. And I hope you join me regularly for these discussions, because I think your insights and your ideas around this, and I'm always up for talking with someone else about the importance of women's health. And there's more people asking about it. When we go out and we talk with people, the number of people that go, okay, but like, I want to know how this plays a role in women's health, or how is this going to be useful in my practice when it comes to women that aren't responding, or, the options I have aren't the right options for that person. And so I think we're asking more questions for women's health, but we're also asking them, I think, better. And I think this is part of a larger discussion. And I think highlighting that autoimmune diseases in the gut are tied together, that FMT could play a role here. Let's ask that question. But as well, for women, what does restoring the gut look like? How is the gut changing for women when we're going through these kind of critical periods in our life cycle? Women's life cycles look different than men's. We have different points and periods that things change. So what does that look like? And so I think it's cool. Awesome. I love it. I want to talk more about it. I talk to you all day, Emma, always. But that's my take. That's probably my rant of things. But what's kind of your takeaway when you look at this question, autoimmune and RA and an FMT and gut health? What from your perspective what does that leave at the forefront of your brain?
Yeah. And I think, this conversation in general, it can be difficult to understand autoimmune diseases if you or someone you're close to isn't directly affected by them. And so I hope that the listeners can have some takeaways from this, that, whether it's just increasing your awareness about autoimmune diseases and how that is related to the gut microbiome, because autoimmune conditions do affect a large population of people. And whether you're affected or someone you know, I think just increasing the awareness is really going to help with the prevention of these diseases. And another takeaway I hope that you all can take from this conversation is that there is a connection between the gut and autoimmune conditions. FMT shows promise for these conditions, RA, Alzheimer's, any sort of neural condition as well. The gut is a very, very important factor in this. So I hope we kind of emphasize that in this conversation. And a key takeaway from that is the microbiome restoration may become the future adjunct to immune modulation and any sort of, mental health condition. And us as people having these conversations brings awareness and education. And I'm really, really excited to see how future research goes. And I'm hoping we can kind of lead the way in the frontier here for women's health, autoimmune, and how everything is related to the gut. And so I really hope that the listeners really think on that. And if you haven't already, I want everyone to share this episode with someone. Maybe it's your neighbor, maybe it's your aunt or your partner, anyone, any woman in your life. I think you should share this podcast episode with, whether they have an autoimmune disease or not.
Yeah.
And I'm really excited that we talked about this today, because like I mentioned, it's something that I personally experience, as well as all the GI distress that comes with autoimmune. And so I'm really glad we were able to sit down today and chat about it.
And as per always, if this is your first time joining us, jump in. There's so many episodes, even just walking through FMT is and gut health. But, subscribe, join us. This is a topic we want to continue talking about. If you're listening to this and you go, I just wish they had talked about X, email us. We are always looking for the next thing to talk about. We want to pick topics that are going to be insightful for the people that are listening, but as well, we learn by having these discussions and knowing that other people are listening, and that's going to change how they're going to ask questions is so key, because the idea is sharing knowledge. Knowledge isn't for one to keep. Let's share it. Let's talk about it. Let's, start new conversations with the people around you and share what you're going through, because the person next to you may also be dealing with something. And the more people talk about it, the more I think support that exists for kind of bringing this forward. And Emma, I appreciate your time so much. I will bug Emma.
Thank you for having me.
And if we want to talk more about women's health and kind of get an understanding what's happening. It's just more people talking about it, the better at this point. But as well for doctors out there that are trying to treat autoimmune diseases and kind of going, okay, so like, how does this fit in? Reach out to us. We always want to sit down and have a conversation with you, kind of present, what data exists, how does this logically fit in, just so that you can kind of look at it as a whole scope and where this fits for your patient population. And as always, I hope you guys join us next time. And thank you so much for listening. And I hope that you join us on the next topic, which we will decide when we find out what people want to hear about or what kind of interest sparks us. Normally it's a new paper or something we have a good discussion about. But thank you for joining, and we will see you next time.
See you next time.